The IDOM was a creation in 2005 to try to get around the issue of academic medical centers being organized into departmental structures. One of the really important challenges to overcome was to break down these barriers and try to get individuals in different departments to work closely together in a seamless way.
IDOM, based on its name, attacks diabetes from various angles, including type 1 diabetes, type 2 diabetes, but also the underlying cause of type 2 diabetes, obesity. And it also has a very sharp focus on metabolism as one of the leading causes of the cardiovascular complication.
What's really special about the IDOM is its people and its place. The people are dedicated, basic researchers, translational clinician scientists, and diabetes doctors who are single-mindedly trying to do what's best for the patients they take care of or for the patients that their research addresses. And they're doing it in a place, the University of Pennsylvania, that is so amenable to this.
It brings together investigators from multiple disciplines using cutting-edge technologies and clinicians inspiring us along the way to focus our efforts on providing a cure for diabetes. That is our ultimate goal.
There is an epidemic of obesity, an epidemic of diabetes, and it's clear that these epidemics are related. We now know that 1 in 3 children born in the US today will develop diabetes in their lifetime, and that number is climbing.
So from a public health perspective, it's just the sheer numbers will overwhelm us if we don't try to gain better preventive and treatment strategies. Who develops diabetes? What are the underlying mechanisms? Can those mechanisms be tweaked? Are there ways to identify these people before they develop the full disease?
We think about genes, we think about environment, but we need to think about those two coming together in an individual. We ought to be able to tailor therapies for patients with diabetes that can make even existing therapies more beneficial for some patients and not give them to patients where it's not going to help them and they might have side effects.
I think IDOM beautifully reflects our focus on translational medicine. The ability to use genomics to make really major breakthroughs in the predisposition to diabetes and our ability to tailor the treatment has been an important breakthrough.
Translation is sort of a catchword now. It's the understanding that we want to take our basic information and translate it into the betterment of the patient. And type 1 diabetes and now transplantation is a great example because we've gone from having no opportunity to do that to a treatment that works. When you talk about diabetes education, there's actually 2 major components. One is the educating the next generation of diabetes practitioners, both physicians, physician scientists, as well as nurses and so on. But there's also the education of the patient. We're well positioned for this because our Rotobod Diabetes Center is located literally just below our IDOM research labs.
The Penn Rotobod Diabetes Center offers patients comprehensive care that helps them understand their diseases and helps them manage their diseases. Patients really get individualized care that's suited for their issues and their problems.
And we have a devoted team of nutritionists, doctors, nurse practitioners, diabetes nurse educators that are helping the patients with these lifestyle decisions as well as with the medications that are prescribed for them.
If you were to look back objectively over the past 10 years, one could be really delighted and enthusiastic about the impact that this concept has had on this very challenging and difficult field. Everybody involved in the program plays a key role. Leadership, high-quality faculty dedicated to this cause, both in adult and children's medicine, wonderful trainees that stimulate us and keep us on our toes and always challenge us to do better, and then our patients and their families who are central to any effort that we really engage in.
When we look at the progress over the last 10 years at IDOM, one can only imagine the breakthroughs that will occur in the next 10 years.
We each have our areas of expertise, and it's really when we we hold hands, when we reach across and talk to one another across disciplines, that we have the potential to move our discoveries forward.
It's the 10th anniversary of IDOM. I'm very proud at all we've accomplished in those last 10 years. New understanding of obesity and diabetes, new applications toward the clinic. But there's so much more to do, and I'm looking forward to the next 10 years for equal, if not more, progress as we fulfill our goal to conquer these diseases of obesity and diabetes.